So, Dr. Gunz, she's a pediatric intensive care doctor at Children's Hospital, London Health Sciences Centre, and an assistant professor at the Schulich School of Medicine and Dentistry at Western University. Prior to medicine, she did a degree in geography, which essentially focused on the ecological, social, economic, and political aspects of climate change. Recently, she's worked to align her interests, working on various research endeavors that strive to better understand the effects of climate change on child health, as well as improve healthcare facilities' understanding of necessary mitigation and adaptation measures. Thank you, Dr. Gunz, for being here. I was hoping you could address our first question that we'll ask to all of our panelists. Given what you've seen in your practice and in your personal experience, what impacts do you see climate change having on children? And how would you advise parents to engage in mitigating those impacts?
Lovely to hear both of your voices. I can't help but smile. Thank you for this. I think the way I'd answer that is to say that I hoped I'd never see, this affect child health. I think I met Dr. Waters and Dr. Sloan a few years ago when we were on a phone call together, as we were all desperately trying to figure out what can we do, to help this situation. And when I did my degree in geography, which is, as you said, was essentially climate change, it was almost 20 years ago. And what we said then was, we need to do something before it starts affecting people. Like that's now we need to make change. And, as I started standing in my ICU, I'm starting to draw connections. And it's really worrying, to be honest. And I think part of it is understanding what I do. Most people in the world don't know that my specialty exists. We run a pediatric ICU that goes from, once a child is born and goes home all the way up to 18. And children rarely get sick enough that I need to meet them, thankfully. And so we see the tip of the iceberg. And so even knowing about climate change and seeing what was happening and the health effects that we'll talk about, I never in my wildest dreams would think that I could draw a straight line. And so one of the things that we worry about is asthma. And that's the first story I'd like to share. So it's about a boy that I'm going to say is David, just to give him a name. And I met David on the day that he died. So David was a previously healthy boy, brilliant, energetic, kind child who was mild asthma. Like some children have really bad asthma and it cripples them and it really affects their life. This is a boy who had some puffers, when he had to run around for a little bit, but other than that, there was nothing else. And so one day he went to school. And it was a hot day, a weirdly hot day for the season. It was in the fall and humid. And he went to school, had a great day, was playing with his friends, and then at the end of the day just dropped. And thankfully there were grown-ups around, so the teachers came and they started CPR, and the paramedics came and they continued the CPR. And then eventually he came to us in the hospital, and eventually his pulse came back, and so his heart started beating again. But the amount of time that his heart had stopped meant that he had such severe brain damage, we knew he wouldn't survive. Like, he was technically alive, but we knew he wouldn't survive. And so meeting this family at that moment, initially they didn't really know why he had died or was dying. And when I met him, we'd done enough tests that we knew this was it. It was his asthma. So speaking to the mom in that moment, I told her why he had died, and the first words out of her mouth were, "Oh, it was really hot out today," and that sent chills down my spine, because I can tell you, I've been in the ICU for, in a pediatric ICU in and out for over 10 years, and never at a moment like that, which is arguably, I think any of us could say, the worst moment of anyone's life. Have I seen a parent go straight to the weather? And I think knowing what I knew, I went, "You're right." And he had a very rare type of asthma where this can just happen. But still, that was a big push. And that is like thinking about how it affects child health. We know it affects asthma, especially with heat and humidity and air pollution. And so and actually looking locally, even in London, Ontario, which is kind of a mild area of Canada, we've just looked at our emergency room admissions, and we can tell that when it's hot, extremely hot, as soon as it gets hotter, the number of children coming to the emergency department increases. And then once you get to really hot temperatures, like over 30 degrees, it goes exponentially up. And then it stays, and it continues for it continues for 7 days, but the number of kids keeps increasing for the first 3 to 4 days. And that's children coming with asthma and other respiratory illnesses, but other infections as well are affected by heat. And so, that is locally, some of the things that we've seen. Other ways that it affects children, other than their breathing, is infection rates. We know that different viruses, and probably people have some familiarity with this, hearing about COVID and all the things that we hope and worry about as the temperatures and season changes. But we do see different illnesses and infections change with that. Children are also more likely to get dehydrated and have different electrolyte balance issues with that, experience heat stroke and shock. So those are common. We are also seeing more tick-borne illnesses. So ticks that carry diseases that used to only live in the northeastern part of the United States are coming up all the way up to Ottawa now. And so Lyme disease is a big concern for a lot of people, which is another issue. And, other than that, the truth is that we don't really know the full impact of climate change now. And I think one of the path that I've gone on since, our first telephone meeting a few years ago is really looking to understand how the health effects are. And so there's a number of studies that we're ongoing now, where we're really trying to monitor that in vulnerable populations, which I know, or I don't like the term vulnerable populations, but people who are really at risk, and children are a huge part of that. And that's locally. If you want to talk about outside of Canada, there are other impacts in terms of, the effect that large natural disasters and floods and hurricanes have on the waterborne system. Children are a higher risk of getting infections from the water and sicker from it, and they get dehydrated, and diarrhea is a leading cause of death worldwide for children. So gastroenteritis, like diarrhea and vomiting illnesses, as well as parasites. We see malaria and cholera moving around, as well as dengue fever, depending on where you are and what constellation of flooding and heat that you're seeing. And then there's many more effects that we don't realize. And I think the other piece that comes with this, and I know that some of the other panelists are going to talk about some of the ecological effects and some of the equity issues, so I won't touch on that, but just as a piece to reflect on while you're thinking about that, displacement is something that we're seeing with climate change. And this is something I'm seeing in my practice. So, in London, we serve the entire west of the province, so going all the way down to the United States border and all the way up to the subarctic. And I've had a few children now. And so one I remember very distinctly, and it was just this past spring. And this was a baby who had been in hospital his entire life because he was born with a change in his lungs that he needed surgery for, and it was too unsafe to fly. But it was safer to do the surgery when he was bigger, so they had planned it for 4 months. So this is a family from a remote community in the north. Where you can just fly in and out. So this family had been displaced for 4 months. And most people who've spent an hour in hospital want to leave. People who've spent 4 months in hospital really want to leave. So this is great. Here you are. I said to the grandfather, this is wonderful. And he did so well after his surgery. You'll be able to go home now. And he said, no. And I said, what do you mean? He's like, you know what? I'm really glad that he's well. But no. And what had happened is there was an ice jam in their community that had happened. That does not happen in the fall, on an unprecedented time. and their community, a number of the houses was already flooding. And at the time that we were talking, there was a different part of where most of the people were, and that had all congregated. They were trying to rapidly evacuate, and that ice dam was due to break any minute now. So and the people were getting out very slowly. Like they were relying on the government to evacuate, and it was happening too slowly. And he was worried that all of a sudden there would be a breach. And even if they did get out, they were fighting to save the water treatment plant. And so, you know, his point being, well, when we get back, like, are we going to have clean water? And then the other piece, and his grandmother said, what about our houses? They're going to be full of mold. And that is not the first. So they were stranded. They didn't have a home anymore. And their entire community of a few hundred people was going to be spread across the north. They had no idea where they were going or who would be with who. And I'm going to tell you, that is not the first time I've heard that story. I've heard that story way too many times now. And there are communities in our north that are getting evacuated every year proactively because of the flooding that's happening now. So I know I don't want to take too much time, but those are some of the stories I can share and why I've dedicated to that.
They're very powerful. Thank you so much.